Atrial septal defect closure. Stephen Brecker, Director, Cardiac Catheterization Labs. Advanced Angioplasty incorporating the left main 5+ course. Conflicts of interest. The following companies have supported educational courses held at St. George's: Augie Medical, BVM, Gore, NMT Medical Incorporated, St. Jude. Atrial septal defect closure. St. George's Experience. Presentation in adults. Indications for closure. Techniques for closure. RV, RA, LA, RUF. Atrial septal defect closure. RA, RA, LA, LA. Fig 9, atrial septal defect and patent frame and oval closure. St. George's Hospital 7-year experience. 1st of October 1998 to 31st of January 2007. 414 procedures. 174 ASDs, 114 female, 60 male. 240 PFOs, 115 female, 125 male. Atrial septal defect closure. Age at referral. Males, 43.8 plus 17 years, range 16 to 77 years. Females, 42.6 plus 16 years, range 17 to 77 years. Atrial septal defect closure. Out of 174 intention to treat procedures, 151 patients received a single device. 9 patients received 2 devices. 1 patient had 2 procedures. 1 patient received 3 devices. 2 procedures. 13 patients received no device. Defect greater than 40 mm, 5. Insufficient rim, 5. 3 defects, 1. Multiple fenestrations, 1. Iliac vein access, 1. Atrial septal defect closure devices used. Atrial septal defect closure implants or osso sizes, M. Atrial septal defect closure. Dual devices. 2 ossos, 6 cases, 2022, 13/16, 7/10, 32/32, semicolon 13/14, 8/10. 1 osso, 1 PFO, 2A11/P25, P35/Griber form 35. 2 Helex, 1, 2025. 3 devices. 3 ossos, July 10, 2017. Combined procedures. 3 cases combined with PCI, 1 with mitral valvuloplasty, 1 flutter ablation. 1 set of non-identical twins. Atrial septal defect closure. Types. Secundum defect. Single, multiple, fenestrated. Primum defect. Isolated or part of avenue septal defect. Superior cavil vein defect. Sinus venosus. Inferior cavil vein defect. Unroofed coronary sinus. Atrial septal defect closure. Atrial septal defect, presentation in adults. Commonly missed in infancy and childhood. Often no symptoms in early life. Children, increased incidence of chest infections. Symptoms increase with age. Greater than 70% of adults symptomatic by 40 years. Palpitation. Dyspnea. Cough, chest infections. Fatigue. Ankle swelling. Symptoms of paradoxical emboli, central and peripheral. Atrial septal defect closure. Atrial septal defect, presentation in adults. Physical signs. Normal or low volume pulse. Normal or raised venous pressure. Prominent right ventricular impulse. Second sound widely split, fixed in inspiration and expiration. Ejection flow murmur in pulmonary area. Mid-diastolic tricuspid flow murmur. Pansystolic murmur, tricuspid regurgitation or mitral regurgitation, ostium primum defect, atrial septal defect closure. Atrial septal defect, presentation in adults. Investigations. ACG, right bundle branch block. Right axis deviation, secundum defect. Left axis deviation, primum defect. Prolonged PR interval. CXR. Moderate cardiac enlargement. Small aortic knuckle. Large pulmonary arteries. Pulmonary plethora. Atrial septal defect closure. Atrial septal defect, presentation in adults. Complications. Atrial arrhythmias. Pulmonary hypertension and right ventricular disease. Eisenmenger syndrome and shunt reversal. Paradoxical embolus. Infective endocarditis, primum defect only. Investigations. Echocardiography. Transthoracic. Toe mandatory, size, rim, pulmonary venous anatomy. Cardiac catheterization. Atrial septal defect closure. Atrial septal defect, presentation in adults. Evidence for closure. ASD in patients ages 60 years or older, operative results in long-term post-operative follow-up. 1955 to 1977. 66 patients aged 60 years or older underwent operative closure. 4 deaths, 6%. 47 patients followed up for 2 to 20 years. 41 improved by at least one functional class. Actuarial survival curves suggested improved mortality compared to age, sex-matched medically treated controls. St. John Sutton M.G. et al., Circulation 1981 64 to 402 to 409. Atrial septal defect closure. Atrial septal defect, presentation in adults. Evidence for closure. Surgical treatment for secundum atrial septal defects in patients greater than 40 years old. 521 patients with secundum ASDs. Randomized to surgical closure, N equals 232, or medical treatment, N equals 241. Median follow-up 7.3 years. Endpoint, composite of death, P, major arrhythmic event, embolic CVA, recurrent pulmonary infection, functional class deterioration or heart failure. Risk of endpoint higher in medical group. Hazard ratio 1.99. Survival advantage when corrected for age, mean PAB, and cardiac index. Def et al. J. M. Cole Cardial 2001 38 to 2035 42, Atrial septal defect closure. Atrial septal defect, presentation in adults. Evidence for closure. Improvement in exercise capacity in asymptomatic and mildly symptomatic adults after atrial septal defect percutaneous closure. 37 patients with mean shunt of 2.1. VO2 max and echo measurement of RV dimensions pre and post percutaneous closure. Significant improvement in VO2 max. Significant reduction in RV dimensions. Brochu MC et al. Circulation 2002 106, 1821 to 1826. Atrial septal defect closure. Atrial septal defect, devices. Amplatzer helix. Atrial septal defect closure. Atrial septal defect, devices. Cardio seal Starflex. Atrial septal defect closure. Atrial septal defect, devices. Biostar. Atrial septal defect closure. Amplatzer septal occluder. Self-expandable, double disc. Nitinol wire mesh, short connecting waist. Discs and waist filled with polyester fabric. Atrial septal defect closure. Assessing for percutaneous closure. Transesophageal echocardiography. Unstretched size. Color flow diameter. Rim. Inner or superior rim often deficient. Assess all rims, anterior, posterior, inferior, superior. Clearance. Atrioventricular valves. Inferior and superior vena cava. Coronary sinus. Atrial septal defect closure. Atrial septal defect technique. Toe versus ice versus fluoroscopy. Local anesthesia versus general anesthesia. 11F sheath RFE. 7F MPA2. Saturations and pressure. Group angiogram. Balloon sizing versus unstretched color flow diameter. Delivery sheath. Device delivery. Stability. Release. Atrial septal defect closure. Intracardiac echo. Atrial septal defect closure. Atrial septal defect, fenestrated defect. Atrial septal defect closure. Atrial septal defect, fenestrated defect. Atrial septal defect closure. Atrial septal defect, fenestrated defect. Atrial septal defect closure. Device deployment. Atrial septal defect closure. Atrial septal defect, cribriform device. Atrial septal defect closure. Atrial septal defect, cribriform device. Atrial septal defect closure. Atrial septal defect, cribriform device. Atrial septal defect closure. Atrial septal defect, cribriform device. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects. Atrial septal defect closure. Atrial septal defect, multiple defects.